All right, let's talk about antacid medications. Any of you who's had GERD or heartburn can identify with this picture. So we are going to talk about meds that are made to kind of cut down on the unpleasantness of excess stomach acid. We are going to be talking about drugs for what's known as peptic ulcer disease, which is when too much stomach acid affects the stomach, and then GERD or gastroesophageal reflux disease, when that acid tries to come up on you. So we've got 4 categories that we're going to talk about. Those are antacids, histamine H2 receptor antagonists, PPIs, proton pump inhibitors, and then drugs generally that are considered cytoprotective, and they just sort of coat and soothe the inside of the stomach and the esophagus. So we've got 3 major categories: antacids, H2 receptor antagonists, or histamine H2 receptor antagonists. Remember that histamine can affect the GI tract as well, and they are H2 receptors, and they kind of work on motility, gastric motility, and production of acid. And then we have proton pump inhibitors. So our stomach lining can have problems as a result of excess acid production. Stress and disease processes can also make us give off more stomach acid when we don't need to. So sometimes people develop ulcers, and we're going to talk about a bacteria that's highly involved in ulcer formation, but other things that can contribute to ulcer formation or may prevent healing of ulcers is regular consumption of alcohol, other drugs or chemicals that can irritate the stomach, disease processes. So in that case, an injury to the lining of the stomach may not be able to heal, and you can form sores or ulcers in the stomach. If they're in the stomach, they're referred to as gastric ulcers. If they're in the duodenum, or the first portion of the small intestine, they're called duodenal ulcers. And anywhere else in the GI tract where they can be exposed to acid, they're known as peptic ulcers. So we have different protective medications, and they're used alone or in combination to treat this whole list. We have peptic ulcer disease, gastritis, which is just inflammation and irritation of the inside of the stomach, sores in the stomach, gastric ulcers, peptic esophagitis, where the esophagus begins to be affected by excess acid eating away at the esophageal lining. Hiatal hernia, where the cardiac sphincter at the top of the stomach becomes overly relaxed and part of the fundus of the stomach actually begins to protrude through it. Hyperacidity and esophageal reflux, which is what the average person has, just too much acid, and it starts to wash up into their esophagus. So these 3 drugs work in 3 different ways. Antacids, which are just the most basic over-the-counter type drugs, can be obtained at any drugstore. And these are discussed on the bottom of page 249, table 13.2. So antacids neutralize hydrochloric acid. They have a very high pH. They would be considered basic. So they are taken to decrease the stomach acid by neutralizing it. And they inhibit the production of pepsin, which is an enzyme that increases the production, or it's a substance that increases the amount of stomach acid. Most of the time, these antacids are made of some type of mineral: aluminum, magnesium, calcium, sometimes sodium. And you can see that they just work to neutralize that stomach acid. However, remember, all those minerals could have an effect on somebody with cardiac and renal issues because of all the minerals. So they have to be taken according to directions. Histamine H2 receptor antagonists displace histamine from the receptor site. So they prevent stimulation of those cells that secrete acid, and that helps to both neutralize the acid and kind of help ulcers heal if they are present. Sorry, I'm all over the place. An example would be famotidine or Pepcid. And these histamine H2 receptor antagonists are discussed in the table on page 250. And Pepcid is sort of our go-to drug given in the clinical setting, and we were able to get it as over-the-counter, although now I think they have kind of halted production of some of those famotidine medications. But they basically block those receptor antagonists so that the histamine 2, the H2, can't work to promote stomach acid. Then we have a stronger kind of drug. These have a more permanent effect. They're called PPIs, or proton pump inhibitors. And we have millions of these little acid-secreting pumps that are embedded in the parietal cells on the inside of the gastric membrane. We have many, many, many of them. And what these pump inhibitors does is to just stop them. They'll stop some of those pumps. And the more you take it, the more the pumps are stopped. And usually this is supposed to be used short term, but I have seen people on proton pumps for ages. They're used to treat duodenal ulcers, most of the time after they've had unsuccessful treatment with antacids and H2 receptor antagonists. An example would be a drug called pantoprazole or Protonix. Protonix is the drug of choice when you're treating duodenal ulcers.